June is Alzheimer's and Brain Awareness Month. According to the CDC, 5.8 million Americans are living with Alzheimer's, and that is expected to triple to 14 million in the next 40 years as our population ages. Yesterday, 13 on Your Side health reporter Elena Holland looked into new treatment for the disease and how to notice the first signs. Tonight, she's here now with one of the biggest components to a memory loss diagnosis, the caregiver. Elena.
Hi, Juliet. So they're not the patient, but their lives are changed forever as well. Often it's a child caring for a parent or someone caring for their spouse.
A journey with Alzheimer's disease is more than fighting a diagnosis.
The outcome of any individual with that diagnosis is going to be largely dependent upon who helps them and how well they help them.
It can be challenging, extremely so.
And once that diagnosis, it becomes real.
Thankfully, Trinity Health Grand Rapids has Susan Woolner.
It's the then what. So I'm the then what person.
She is the patient and caregiver support coordinator.
I spend pretty much my whole day talking to patients and caregivers.
And what she's learned.
It's emotional trauma, it's physical trauma, it's loss of future.
First, it's a change in mindset with interacting with the person you love.
It's dancing differently.
Woolner talks about some of the ways that's seen at home. A caregiver may experience their loved one shadowing them or following them around the house. They could begin to ask the same question multiple times, or perhaps have trouble with cueing, or a series of actions to complete another one.
Or it's time to go, and that cueing of what needs to happen before they actually get out the door sometimes can take an hour.
Support groups can help the caregiver emotionally, but also learn different ways to cope with everyday things.
You can also put things in place, shoes that slip on and Velcro, all those things. You can't change the person. You can change the environment and how they react to the environment.
Dr. Kevin Foley.
A lot of the approach is intuitive.
Is the medical director of Alzheimer's disease and memory disorders. He suggests thinking about why the person with Alzheimer's is thinking about something in a specific way. Try not to bring them back to the present, and don't correct or chastise them for something they may not have done well.
And it's also important for the caregivers to use techniques of distraction and redirection and reassurance.
Meanwhile, Woolner wants caregivers to take care of themselves as well.
They miss key health things in their own person, and they almost die before the person they're caring for does.
Because the important role of caregiving is often overlooked.
Healthcare system focuses on the person who's the patient. Well, the caregiver isn't the patient, but they are the window to the patient.
Elena, what are some ways caregivers can feel supported?
Yeah, Woolner strongly suggests finding a support group. She conducts many at Trinity Health Grand Rapids and says you do not need to be in the health system to attend a group. There is also the Alzheimer's Association, which will connect you with caregiving groups and other resources. But also, she reminds not everyone is made out to be a caregiver, and that's okay too. And don't hesitate to ask for help.